Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha reporting for the week of March 21st, 2022. Today, I am going to review what is going on with the pandemic overall, worldwide, what we can be looking towards next. Are we heading into another surge? What's going on with BA2? And what we should be thinking about next. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Cases in Alameda County continue coming down. We are now at about 1,800 cases for the 14-day prior, and this is about where we were in early December, just when we were starting to uptick with the wintertime surge. So still not back down to the baseline we'd like to see. It's kind of looking like it's leveling off there, but we look forward to continuing to see this hopefully come down. Hospitalizations have come down nicely. We've got 58 people in the hospital with COVID-19, and of those, 2 are in the ICU. So that is getting nice and low, thankfully. 11 more deaths were recorded on the Alameda County dashboard. So that brings us to a total of 1,815 people who have lost their lives to COVID-19. In Alameda County, we are continuing to tick up slightly in terms of vaccination rate. So that is more good news, with 83% fully vaccinated in Alameda County. And Oakland is just lagging a little behind at 81% fully vaccinated. And pretty much all of the age groups are in the 80 percentile, with the exception of our 5 to 11-year-olds, where we are still at just 59% fully vaccinated in the 5 to 11-year-old age group. So definitely lagging behind there. Now, when we look worldwide at what is going on, cases are no longer coming down. They're actually upticking again. So cases are back on the rise worldwide, and you see we never got back down to any kind of reasonable level before things turned around and headed the other direction. So that's certainly not a reassuring sign. And when we think about all of our past surges here in the United States, most of them were preceded by a surge in Europe, in the UK, then in New York, then in California. And that's been a little bit of the pattern that we've seen most of the time. And you can see here that cases in the UK are in that pink color, and in the US in the blue. And as you can see, the UK is sharply upticking now. But it's notable, if you look back on all of the other waves, that more or less it started the uptick in the UK, and then shortly thereafter, within a few weeks or so, sometimes a little more, sometimes a little less, the United States began with its uptick. So the waves are looking like they're marrying each other fairly well here. So that, of course, does not bode well when we see the fact that there is a UK surge in cases happening right now. So will the U.S. follow behind? The U.S. cases were really kind of plunging dramatically. Now they're leveling off a little bit. So we're definitely concerned that we may be beginning to plateau and then possibly going to head the way of the UK back in the wrong direction. So we'll just be having to keep an eye on that. And I'll talk in a little more detail about what all this may or may not mean in a moment. But bringing us to the United States, comparing between New York and California, similar pattern. And you can see again that the waves kind of mirror one another. And it might be a little hard to tell on this graph, but New York is beginning a slight uptick in cases. So UK is already upticked. New York is starting to uptick. California has not begun to uptick yet, but maybe leveling off a bit. and globally cases are increasing as well. So, what does all of this mean? And we know that cases is what we've really relied on quite a bit up until now, and case data are probably becoming less reliable. We still think there's value in looking at the ups and downs, as I've just kind of walked us through, because we've got some patterns going on. But I think we also need to acknowledge that case data is going to be less reliable now because many people are doing home tests and those results are not being recorded. In fact, there's quite a bit less effort now on data collection for cases, which, in my opinion, is an unfortunate turn of events given that we're still in the middle of this pandemic. We're also at a moment where funding for testing is being reduced considerably. We are seeing testing sites closing down as we speak because of a loss of federal reimbursement or funding. And so those are all concerning and kind of contribute to this concern that case data is not going to be as reliable an indicator as it has been in the past. So now we really need to look at multiple different sources of data to try to understand what is going on. And we saw that the CDC changed its metrics to really try to guide what kinds of interventions like masking we're supposed to be doing. And they're looking at very late indicators like hospitalization status. That is a lagging indicator. We really don't want to be guided by hospitalization data or death data because that happens long after it's too late. The wave is already hit and we're already dealing with some of our lagging indicators. So what can we do to look at leading indicators? And I will get into what that could look like in the future. But first, I want to address a lot of the questions I've been getting. Will we do better or worse than the UK? A lot of theories going around, and I think it's worth mentioning that every time so far that the UK is spiking, we seem to have theories flying around on why we're going to do better than the UK. But it's all speculation. I can appreciate being hopeful as much as the next person, but I think that we should be grounded in some reality here and also let history be our guide to some extent. Of course, there are many factors that are different between the UK and the United States, but there are also many factors that are the same. And so, frankly, I think you could hypothesize in either direction that we're definitely going to do better or we're definitely going to do worse. And I think time will tell. But I think in general, I'll just point out a few facts. The UK has higher vaccination rates for adults, and they also have a much higher booster rate for their 65 and up population than we do here in the United States. And this is concerning, and I'll talk a little bit more in detail about this. But we are most concerned that those who were boosted early, like our elders, those over 65, may now be in that category where their immunity is waning. And such a small fraction of our 65 and up have taken up the booster so far in the United States. And this is concerning because we know that with Omicron and including its subvariant, the booster is really what is bringing that protection back up to a reasonable level, and that without it, we're really concerned, especially about anyone who may have underlying conditions or those over 65 years of age. Also, the United States rushed much more quickly to get people fully vaccinated. So that means that more time has passed since people have become vaccinated. So we may be looking at immunity that is waning earlier and more quickly than in the UK. And given that the likelihood, if we do see a similar wave as the UK, that it will be again weeks or maybe a month or more later, then that's even more lag time for more waning immunity. So that is still something to be keeping an eye on, something that we need to be concerned about, and really try to urge folks that are in higher risk categories to get that booster dose. The UK uses the mRNA vaccines, but they also use other vaccines, so it sort of remains to be seen what's the level of protection, the duration of that protection. Definitely have mixed reviews so far, and again, timing seems to be everything. And I think there's a lot of similarities between UK and US in terms of kind of the seasonality. The times of our seasons are similar. The school schedules are similar. And the fact that they're now really attributing the spike to BA2. And we are seeing that here, which I'll go over in a moment. But essentially, in the UK, they are not only having increasing cases, but they're also having upticks in hospitalizations, and they're even now seeing some early upticks in deaths as well. So this is not just a matter of cases, as we've seen with every wave, and I think that we can expect that we'll continue to see, is that we first see cases. More cases means more hospitalizations means more death, and that is just sort of the fact of where we are. Now, we've heard a lot of talk about this hope that the United States will have some kind of immunity wall because we've been so slammed by Omicron and so many people caught it, and then many people are vaccinated. So between all of that, that we should have some kind of immune wall. Well, as I mentioned, many people are starting to get kind of months out from their booster doses. Many have not chosen to get the booster doses. And I think we need to be careful on how much protection we are thinking we'll have from infections. So there was a recent article in Cell, and I put the link in the post. And it was not very reassuring as it relates to Omicron infections. So when they were looking at breakthrough infections, and they noted that there was not a lot of sort of cross activity of our antibody response. So if you got Delta, the cross reactivity to Omicron or vice versa appeared to be limited for those who had breakthrough infections. And they also noted that those who had mild breakthrough infections had much lower antibody titers. And so this is also concerning because we know that many of the Omicron infections were in fact mild, but that means that if there wasn't a big response, then we can't rely on this kind of wall of protection. And I thought that this finding was significant, that people who had breakthrough infections with the Delta variant had almost 11 times higher antibody titers compared to those with the Omicron breakthrough infections. So this is fairly significant. And then last but definitely not least, the increase in antibody titers from an Omicron breakthrough was about a third of that you would get from the booster dose. So I heard a lot of people talking about they caught Omicron, so they're boosted already. That's not quite bearing out. And so the actual increase in antibodies for those who had an Omicron breakthrough was only 1/3 of that people got from an actual booster dose. So the recommendation at this point is still to get that booster, particularly if you're in the elder age groups or have those underlying conditions, because we really cannot rely on a response to an Omicron breakthrough, especially if it was a milder course. And remember, when we say mild, that means you didn't go to the hospital or need oxygen or go to the ICU. Most people are not reporting feeling like it was mild, but when we say mild, that is actually what is meant, is that it wasn't severe enough to take you to the hospital. So with all of that being said, our case rates are not going to be as reliable. We can't afford to wait till people are in the hospital to change things or to intervene. So there's been a lot of talk of wastewater surveillance, and the CDC has put up a tracker. I showed it a few briefings ago, and here is a screenshot. And the red and orange and beige and yellow, all those dots are showing wastewater surveillance sites that have increasing positivity of SARS-CoV-2 in the wastewater. And so the blue ones are kind of still going down. The concentration of kind of the red and orange appears to be in the northeast portion of the country. And again, this really does follow sort of the patterns that we've seen before. And so if we are going to see a wave, the likelihood is that it starts east and moves out west. So we will certainly be keeping an eye on this. This is definitely not a perfect indicator, and we don't have coverage of the entire country. There are pockets that don't have much coverage at all. And we hope that this will continue to increase because wastewater is sort of poised to be this early warning system, if we can kind of get the infrastructure to be widespread enough and where it can be actionable, where we can react to it. So it doesn't seem like we're quite there yet, but at least we're at the point of monitoring it, and we're at the point of, it appears, transparently reporting it. So these are definitely improvements, and hopefully these will lead to actual implementation of different strategies to try to prevent the surges before they actually happen. Worst case scenario, maybe they'll just be enough to let us know that we need to individually change our behavior. Best case scenario, maybe we can use this data to actually intervene and maybe put in place some more population level interventions. So all of this, I think, remains to be seen. Now, with respect to BA2, here is the CDC's tracker that looks at variant proportions, and really this BA2 is kind of on the move here. It's almost doubling every week, and it is now comprising about a quarter of the specimens that are being sequenced. And so it is definitely pushing aside the other variants, including the main Omicron BA1, and it is really replacing BA1 in many parts of the world already, and it's doing so at a fairly good clip. Maybe not as fast as BA1 did, but it is certainly happening. And it is looking to be more contagious. So it is spreading to more people, just in general, within households, all of the ways that what they call secondary attack rate is measured. The UK has a technical briefing that I also included in the post that goes into this in a lot more detail, but suffice it to say, BA2 is quite a bit more contagious than BA1. And it does not look like it is more virulent, so it is not necessarily making people more sick. But as we saw with Omicron, being more contagious means more cases, again, means more hospitalizations, and unfortunately more deaths. So will these surges be caused by BA2? Is BA2 different enough to give us a very big surge like what Omicron did? It is possible. It is quite a bit different than BA1. Some people think it should have just gotten its own Greek letter, but nonetheless, it does evade one of our treatments. Luckily, the Paxlovid is still effective. The pill is still effective. Again, you have to be tested and start that treatment within 5 days. There is a new monoclonal antibody, bebtelovimab, which is also effective at neutralizing BA2, and it is becoming more available. It has to be started within 7 days. So all of these things require getting tested in time in order to get treated in time. And so it is possible that we will see a sharp uptick of cases of BA2, just like what the UK is seeing now, and that it can lead to increases in hospitalization. But I think one of the bigger concerns that I have is that we could be in for another variant, and that's just something that is going to be a reality as long as we have all of the pressures that we have right now. New variants are emerging all the time, and this virus is spreading at such a rate, it continues to be spread at such a rate that it has many, many opportunities to create new mutations. And those mutations are at this point, we're concerned about them still because why? Because first of all, we really don't know exactly, we cannot pinpoint how all the ones before have come about. And this is problematic because, of course, it makes it more difficult to target an intervention when we don't know exactly how these things are emerging. But all of the theories that we have are all concerning and very difficult to intervene on. And so, one is that a mutation can actually happen inside of a single individual who has a prolonged course of COVID 19. So, someone who's immunosuppressed, maybe they're on chemotherapy or have AIDS and they get COVID and can end up with a prolonged kind of a chronic infection, then during that time, the virus can actually mutate in that person and then they can then spread it. Also, human to animal and animal to human transmission. This is how it all got started. And we know that there are reservoirs of SARS-CoV-2 within deer and mink and other mammals that can get COVID-19, and it can jump from the animal reservoir to humans and back and forth, and it can actually evolve within the animal reservoir and mutate and go back to humans. So this is another area of concern that we need to be looking at. And another thing that may be able to create pressures at some point may be treatments or medications that are used, and we see this with sort of resistant kind of strains and things like that. So we don't know yet if this is happening. It definitely was a concern with one of the kind of less desirable treatments, the molnupiravir. That treatment is kind of considered almost last line treatment, in part because of this concern. So this is something we absolutely need to be keeping an eye on. So new mutations, new variants are a concern to be keeping an eye out for. With BA2, the big concern is that we may be in a place here in the United States of waning immunity for many of our groups that we're concerned about, like our over 65s or those with chronic illnesses. So if you are in that category, first of all, if you actually have an immune compromising condition, then you are someone that probably should have already had their 4 doses. So please do check in with your provider. If you're someone who should have had a 3-dose initial series because of immune compromise, if you are on steroids or had a transplant or on chemotherapy, or on medications for autoimmune disorders that may be suppressing your immune system, then those are all situations in which you actually should have had 3 doses for your primary series and then a booster, a 4th dose. Now, at this time, both Pfizer and Moderna have submitted emergency use authorization applications for a 4th dose for more than just people who are immunocompromised. So Pfizer is asking for the EUA for a 4th dose for those 65 and up. Moderna is asking for it for everyone. And so it remains to be seen whether those will be approved. And frankly, it remains to be seen if it really is necessary for everyone or just over 65 or who we need to do this for, if anyone, because we do know that our antibody response is waning after somewhere in that 4 to 6 month range. So this is why when we have people who are now 7, 8, 9 months out from their booster, we may be concerned about those folks. So we'll see if there will be an emergency use authorized for the 4th dose. It will be great to see what the trials look like as to what benefit is truly conferred, because just having a boost in antibodies isn't the end all be all. Remember, we have that second line of defense, our cellular immunity, and that seems to be hanging around for a while. So we still have a lot to learn in this. Hopefully we'll have a way to actually test for this so that we can know if we need a booster or not, but we just are not there yet. So aside from our over 65s and our folks who have underlying conditions, the other group that we are worried about is our babies. So our under 5-year-olds still cannot be vaccinated. They are completely unprotected. And so we have to do all that we can to protect them until the point when we have an approved vaccine. So the MMWR report recently published shows that during the Omicron peak, we had a very significant increase in hospitalization rates among our 0 to 4-year-old children. they were 5 times higher. Hospitalization rates were 5 times higher during the Omicron period in 0 to 4-year-olds than during the Delta period. We also had worsening impacts for other age groups among the children, but of course, I'm bringing up the 0 to 4-year-olds because, first, that is very significant, 5 times higher hospitalization rate. Hate to have our babies hospitalized like this, and really hopeful that we will have a vaccine for them soon. But as I reviewed 2 briefings ago, that hospitalization and death is obviously not the only thing we're worried about. We are certainly worried about long COVID in our children as well. And we are just beginning to scratch the surface of understanding of long COVID in adults, let alone children with their developing bodies and brains. So in this next phase, I just want to underscore the fact that again, we have very low vaccination rates for 5 to 11-year-olds. We need to address that. We have no vaccine for 0 to 4-year-olds. They need protection. We are in a moment where mitigation strategies that would otherwise protect them, such as universal masking, is no longer required. And so if and when we do experience increases in cases, this is what we're worried about, sort of our extremes of age, those with underlying conditions, and those who are completely naive to SARS-CoV-2, meaning no vaccine and no prior infection. Prior infection is no comparison to the vaccine and booster, but at least your body has seen it before, and at least there's something there. We probably all still know people who have not caught COVID and who have not gotten vaccinated yet. Those are the people that we really need to be concerned about. Please keep talking to those folks. Make sure they're getting all their questions answered and that they're talking to their doctor about how to best protect themselves, because BA2 is even more contagious than BA1, and it is displacing BA1. So pretty soon that will likely be the main strain that we're working with, and it's going to get harder and harder to avoid catching it. And it is still very much a roll of the dice if you do not have any antibodies, which is going to be the case if you've never had COVID and you've never been vaccinated. So please remember that in terms of the safer choices that we can be making, a high filtration mask indoors is much better than cloth or surgical. If you're not vaccinated, please stock up on N95s. In fact, I'm stocked up on them. I think everybody should stock up on them. Instead of stocking up on toilet paper before this next wave, how about we stock up on N95s or KN95s and antigen tests at home? We should all have a good supply of antigen tests. If you haven't ordered your 4 free, and now there's another 4 free, please go ahead and order those. And also please stock up on N95s or KN95s. We are distributing at Roots at our main site, 9925 International Boulevard, the N95s as well as the antigen tests. And so we really want, if I could just saturate Oakland, and especially East Oakland, with N95s and antigen tests, I think that will position us much better to handle our upcoming surges. And it is warming up. It's very nice out there. So remember, outdoors is safer than indoors. We can plan our gatherings outdoors and get creative and really have a much more relaxed, much better time if you're not worried about your indoor space filling up with SARS-CoV-2. If you do not have a primary care physician, please get one. And please take good care of yourself. Eat a balanced diet, get some exercise, manage your stress, take a multivitamin supplement, consider additional vitamin D supplementation, and get a good night's sleep. Thank you so much for joining us, and we look forward to seeing you next Tuesday at 10 a.m. See you then.